A busy one in Southwest Florida when it comes to colds. Typically, adults get 1 or 2 per year, with children getting up to 6, and they usually last 4 to 5 days.
Along with the runny nose, the cough, and sore throat, a lot of cold myths are circulating as well. WING News health and medical reporter Amy Osher breaks them down for us.
So you've had a cold and think you're done for the year? Because you may have heard there's just one cold virus. You'd be wrong.
There are over 200 types of viruses.
Dr. Hendricks has been seeing patients with cold symptoms for 30 years, and he's heard all the myths.
It's a common thing for me to see people come in during the day to want an antibiotic to treat their cold symptoms because it seemed to work before, but it really just creates more problems with antibiotic resistance in our community, because if we're treating these viruses with antibiotics, the bacteria out there are going to become more and more resistant.
So should you be using vitamin C instead?
Studies have not shown any benefit to taking vitamin C in preventing colds or treating the symptoms.
Hendricks recommends only going to the doctor if you get a high fever or if your cold symptoms are causing great discomfort. Otherwise, use over-the-counter medicine, drink lots of fluid, and rest.
An interesting study a few years ago showed that people that get less than 5 hours of sleep a night actually are 3 times more likely to get the common cold virus.
So the best preventative is just taking care of yourself, and that's no myth. Amy Osher, WING News.
Amy, thanks. And remember, a cold is only one of those things circulating viruses. There's also the flu, there's COVID, there's RSV, other respiratory illnesses as well. And you can have one or more of them at the same time. If you have more of them, that's really tough going.
I know, that's the pits. This is the worst flu season in